Hello, everyone. Today, our featured speaker is Dr. Joanna Cohen. I could go on for quite a while about Dr. Cohen's work and accomplishments, but in short, she is the Bloomberg Professor of Disease Prevention and the Director of the Institute for Global Tobacco Control at the Johns Hopkins Bloomberg School of Public Health. And she also holds an appointment in the Dalla Lana School of Public Health at the University of Toronto. Dr. Cohen has been involved in tobacco policy research for over 20 years. Trained in epidemiology and health policy, her research interests focus on the factors that affect the adoption and implementation of public health policies and on evaluating the beneficial effects and the unintended consequences of such policies.
Thank you so much. I'm really delighted to be with you all this afternoon and appreciate you joining just before the holiday weekend here in the US. Maybe I'll just start with a few minutes about my path, how I got here. So I grew up in Montreal in Canada, and then I went to McGill University for my undergraduate work. I did physiology there, and then I went to the University of Toronto to study epidemiology, and that's where I was awakened to the wonderful world of public health, and I just got so excited about the ideas that you can think about preventing disease on a population level. So I got hooked, and eventually I went to the University of North Carolina in Chapel Hill to do my PhD in health policy. And then I went back to Toronto where I got a faculty position, but also I was working at the Ontario Tobacco Research Unit, which was sort of based at the University of Toronto, but responsible for evaluating the provincial Ontario tobacco strategy. And in its heyday, the government of Ontario, that's the province that houses Toronto, the government of Ontario is spending $60 million a year to prevent tobacco use. So we were sort of the evaluation arm and research to look at how that was going. And then eventually I was able to have the opportunity to come to Johns Hopkins, and particularly the Bloomberg School of Public Health, to lead the Institute for Global Tobacco Control. And we do domestic work that's funded by NIH and the Robert Wood Johnson Foundation related to so with NIH, we have a study of e-cigarette users going on. With Robert Wood Johnson Foundation, we're looking actually at health equity issues related to e-cigarettes and heated tobacco products. And then we also do a lot of global work, and that's mostly funded by Bloomberg Philanthropies, which is supported by the former mayor of New York City, Mike Bloomberg. So I love my job. As Sam said, I've been doing this work for over 20 years, and I'm still super excited to get up and start work every day. I get to work with a lot of amazing people here at Johns Hopkins, but also across the country and across the world. And I work with not only academics, but also people who work in non-governmental organizations, people who work in government, all kinds of sectors, because it really takes a village and more to do this work. So I think what I'll do is I'm going to go ahead and share my screen. So what I'd like to do is focus on tobacco and really talk about what are the problems related to tobacco, and especially what are the solutions. So my presentation, right, go over here. Okay, so really it's a pretty simple outline. I'm going to talk about the problem. So what is the magnitude of the issue? Why is it a problem? And then I'll go into some of the solutions. And I'd like to also, through this talk, show you a few frameworks that I use in my work. And the thing that's great about them is they can be applied to all areas of public health. So, so I'm going to take the opportunity to show a couple of them too. All right, so let's start with the problems. So this is just sort of the big picture overview of the global burden of tobacco. And, you know, the numbers are so staggering that it's really hard to understand them and to see them almost as the huge problem that it is. So basically, this is the world's single leading preventable cause of death. And we have now, according to the WHO, more than 8 million people dying from tobacco products each and every year. So smokers are losing many years of productive life. And what's interesting is that a large portion of the deaths, actually a majority, are already occurring in low and middle income countries. And and the numbers for the future are really depressing. You know, it's estimated that at the current rates, we'll be losing 1 billion people from tobacco just in this century alone. And really, you know, every single death from tobacco products is preventable. So none of these deaths are needed because we don't need tobacco to survive. So it really is a tragedy. So let me start with the first framework I'd like to show you. And this is actually draws from infectious diseases. It's called the epidemiologic triangle, and you may have seen it already. And sort of epidemiology really looks at the who, what, and where of what's happening. And I like this, this model because it gives us an idea of the types of things to think about regarding the causes of disease, or the causes of health issues. And you can also use it to think about the solutions. So the host is the actual individual who's, let's say, susceptible to smoking, or it could be the smoker, tobacco user. The agent is what's causing the disease. So in infectious disease, it could be a virus or a bacteria. But for us, it's the tobacco product, so a cigarette or a Juul or smokeless tobacco, etc. The environment is everything around us that actually really influences how well the agent gets transmitted to the host, and affects our norms. So I'll be going through that. And then the disease vector is what specifically brings the agent to the host. So in infectious diseases, the mosquito is often a disease vector because it will bring various diseases to the host. But in our case, the disease vector is the tobacco industry. So I'll talk about the tobacco industry as well. So I'm going to go through each of these sort of 4 areas to describe the problem. So let's just jump into the host. And again, thinking about the epidemiology, this graph shows global cigarette consumption from let's say the 1900s all the way up to, well, about 10 years ago. And you can see the rapid increase in global consumption of cigarettes over that period. And you know, more recently, it's certainly flattening out, which is good news. I like to show these global maps just so, again, you can see the big picture of what's happening. So this is a map of the world, and the darker the color, the higher the level of smoking prevalence among males. Okay, so the darkest color we see represents a smoking prevalence of at least 40%. So at least 40% of males are smoking in those countries. So a lot of smoking in the former USSR and in China and Southeast Asia, parts of the Middle East, you know, and other parts in the world as well. And so I want to next show you what this map looks like for females. So let's go to that. So this is the map for females. And the first thing you'll notice is it's a lot lighter. And the second thing, I think, is that some of the areas where it was very dark for men, like China, Southeast Asia, in here, even the Middle East, it's much, much lighter for women. And that's great. Partly it's because of religious reasons, cultural and historical reasons, but we like seeing low rates of smoking among women, and we want to keep it that way. And the good news overall is that smoking rates are going down. They're going down both for females and for males, and we're seeing them going down in high income, middle income, and low income countries. But there's still a long way to go. As I said, we're still at 8 million deaths each and every year. So one of the important things in looking at this picture is that we can't ignore China. So this is what I call a donut graph, and the dark section on the left is the number of, or represents the proportion of cigarettes in the world that are consumed in China. So the note on the side here says that more cigarettes are smoked in China than in the next top 29 cigarette consuming countries combined. So more cigarettes are smoked in China than in Russia, the US, Indonesia, Japan, Germany, India, Turkey, etc., for 29 countries. So if we're going to do something about deaths from tobacco products globally, we cannot ignore China. And of course, the reason why we care about tobacco products and public health is that it kills people. So this, again, is a map of deaths for males due to smoking. It's the percent of total deaths in a country that are attributable to smoking, and the darkest colors are at least 25%. So at least a quarter of male deaths in the darkest countries can be attributable to smoking. So clearly, and there is a lag between the use of the product and then when you're going to die from it. So we still have, things are still going to get worse in terms of deaths before they get better. All right, so that's like a quick overview of the host, and we're going to move into the agent, so the tobacco product itself. So why is it a problem? Well, tobacco products are a problem because of their constituents, what's in them, and their emissions. So what comes out when you burn tobacco products for those that get burnt, or aerosolized in terms of e-cigarettes. So basically, it's here in the middle. These products contain cancer-causing chemicals, they contain toxic metals, they contain poisonous gases, and these are not just dangerous, but they're deadly, and this is the problem why they cause so much death and disease. And this sort of lays out the cancers on the left-hand side and the other chronic diseases on the right-hand side that smoking has been determined by the US Surgeon General to be caused by smoking. So basically, smoking is harming every single organ in your body, and even has now been, determined to be a cause of things like diabetes, tuberculosis, rheumatoid arthritis, and it affects our immune function as well. So definitely lots of vulnerabilities in the time of COVID. But overall, this is why smoking kills so many people, because you inhale, it gets into your lungs and into your bloodstream, which gets pumped all over your body, and it causes disease in every organ. So the other thing with the agent is how it's packaged and sold. So these are Camel packs from Mexico, and I'll be showing you a number of pictures of cigarette packs because I'm really interested in those, and we actually have a multi-country study that involves going into countries and using a systematic protocol to purchase cigarette packs. And we do that for a couple reasons. One is the health warning label, which you'll see at the top of the pack here. It's a picture of tongue cancer. But so we want to see if the tobacco companies are putting the health warning labels on in the way that they're supposed to, whether they're complying with the requirements. But we also code the purchase and code the packs for all the marketing appeals and design features that they have. So it gets us some insight into what the tobacco industry is doing in specific countries and what the trends are around the world. So these are some Camel packs. This is a Lucky Strike pack, also from Mexico, and you can see the beautiful, designs on the sticks as well. Here's some more packaging. I can't, leave out Marlboro for sure. They're the world's #1 brand, and you can see all this beautiful, branding on these packs. In Mexico, they call this one on the left the watermelon pack because it has, the red in the middle and the green on the outside. And I'll just, again, here's a couple more Marlboro packs, and these are capsule packs. So they actually have capsules in the filter that you can press to release a taste or an aroma, and they have 2 different ones. That's why it's called double fusion. And the Pall Mall pack has the same thing. They call it the mystery, variant of Pall Mall. They also have capsules, and I'm actually doing a study with a chemist, and they've analyzed what's in the capsules. So we're just working on the paper there. So this is all really important to consider when we're thinking about the agent. And then there's like JHU, which we can't ignore at all. And one of JHU's innovations is moving to the use of nicotine salts. So that's how they, so normally in cigarettes, the tobacco companies make the tobacco that you inhale, or the emissions that you inhale, slightly acidic. But the problem is that that's a bit difficult to inhale. So if you've inhaled a cigarette, like a lot of people cough the first times, it's actually pretty repulsive for most people. But JHU has created and patented these nicotine salts, which makes the nicotine solution more basic and easier to inhale. So that's part of the issue that makes it so addictive. They can also put a lot more nicotine in because it's more palatable when it's basic in the salt formation. So it's more palatable, easier to inhale. You can inhale more nicotine, and that's why a lot of young people have gotten addicted to JHU. And I'll be, most of this presentation actually talks about cigarettes, but I'm very happy to talk about e-cigarettes in the Q&A as well. So let's just move on to the environment. What are some of the problems related to the environment? Well, one is that cigarettes are easily available, accessible, and they're advertised heavily, particularly in this country and others. So lots of advertisement, lots of interest, attractive displays in the store to get your attention. Price is also an issue. So the cheaper the product, the more likely people are going to buy it, and the tobacco companies do a lot of couponing and 2-for-1 to try and keep the price low to the consumer. And then there's all these, the general norms of society that are really important. So tobacco companies have sponsored all kinds of parties and concerts and lounges and all kinds of things. And then you see tobacco products being used in movies, you see it on social media. All that is paid for and planned obviously with influencers that you all know well. So all of these factors in our environment also influence whether people are using these products. And then finally, the vector of disease. So that's the tobacco industry, and the industry fights us every step of the way. When we're in public health, like if you're fighting malaria, for example, it's not like the mosquito, that there are well-financed groups rooting for the mosquito. In our case, everything we try to do to protect health, there's a well-financed industry kicking and screaming and fighting you each step of the way. So it makes our work extremely challenging. It's hard enough to change behavior when you don't have an extremely strong and powerful opponent. So the tobacco industry does all kinds of things, and I list some of them here. They try and undermine science, go after scientists. They do corporate social responsibility to try and gain credibility and respectability. But so all kinds of things, and I could spend a whole day on all their strategies. A lot has been studied and written about their strategies. Now, this is probably before your time, but this was a huge turning point in how regulators and society, at least in the US, thought about tobacco companies. And this is a famous committee hearing where they brought in the CEOs of the top 7 tobacco companies in the US. And maybe, let's see, I'll show you just let's see if this works. If not, that's okay. Let's see if this will work.
Let me begin my questioning on the matter of whether or not nicotine is addictive. Let me ask you first, I'd like to just go down the row, whether each of you believes that nicotine is not addictive. I heard virtually all of you touch on it. Just yes or no. Do you believe nicotine is not addictive?
I believe nicotine is not addictive, yes.
Mr. Johnston.
Congressman, cigarettes and nicotine clearly do not meet the classic definitions of addiction. There is no intoxication.
We'll take that as a no. And again, time is short. If you could just, I think each of you believe nicotine is not addictive. We just would like to have this for the record.
I don't believe that nicotine or our products are addictive.
I believe nicotine is not addictive. I believe that nicotine is not addictive. I believe that nicotine is not addictive. And I too believe that nicotine is not addictive.
All right, let's get out of that. So that was huge. This was in 1994, and how could anyone, including users of these products, believe that nicotine is not addictive? So it really turned the corner of how governments were willing to do something about cigarettes. It takes a long time at the federal level in this country, but states and cities and counties did moved forward. But this really was a turning point, and this actually led to a lawsuit where the tobacco executives and the companies were charged as racketeers, which had been used to bring down the U.S. mafia. But so they went after these executives, and they were found guilty as charged. So this was a judgment in 2006, and the judge found the major U.S. tobacco companies had violated these racketeering laws, and this is key, they had engaged in a decades-long conspiracy to deceive the American public about the health effects of smoking and their marketing to children. So, and there's a really, I think it's like an 800-word judgment that goes through the evidence around all of this. So again, another key turning point. So the World Health Organization also wrote a report. This is, do I have the year, in 2000, and they were looking at tobacco company strategies to undermine activities at the World Health Organization. And I think you haven't heard from Dr. Josh Sharfstein yet, but he was actually at the World Health Organization. I think he was doing an internship at the time and contributed to this report, which is an interesting fun fact. So maybe you can ask him about it when you see him. But one of the conclusions, let me just read this for you. It says that tobacco use is unlike other threats to global health. Infectious diseases, mosquitoes, do not employ multinational public relations firms. There are no front groups to promote the spread of cholera, and mosquitoes have no lobbyists. And of course, the implication is that the tobacco industry does all of these things. And so their conclusion was that the evidence presented here suggests that, addressing this huge burden on global health isn't just about understanding addiction and curing disease, but as importantly, it's about overcoming a determined and powerful industry. And I think this was said really well. So in public health, we think, as we think about the causes of disease, the disease vector is certainly important, and especially in this case. So let me move on to solutions. And I know I'm going quickly, but we'll have some time for Q&A, and happy to address any questions you have. So again, I'm going to start with a framework. This section, and one I think is helpful in thinking about public health, and this is Tom Frieden's Health Impact Pyramid. He published this in the American Journal of Public Health, and Tom Frieden was the health commissioner for Mayor Bloomberg in New York City, and then became head of the Centers for Disease Control and Prevention. And now he's doing some other important things. So the interesting thing here is he lays out this pyramid, and he says, as you go down to the base of the pyramid, these types of public health interventions have the most or an increasing impact at the population level, if you can go, to the lower levels. And as you go up, the challenge is that you need more individual effort to make change. So some of the, I'll just give you some examples. So counseling and education, some of these interventions is, you tell people to use condoms, you tell people to eat healthy or exercise more. And that's great, and that's important, and it has impact when you're doing that. If it's a physician or other healthcare provider telling a patient that, it has some impact. But that's not going to move the needle at the population level, and it creates a lot of effort on the part of the individual to now change their behavior. Clinical interventions are things like medications for high blood pressure. That helps prevent further disease. So that's good, but again, you're having to, treat people one by one, and you're not preventing anyone from new people coming in with high blood pressure. Some of the long-lasting protective interventions are things like immunizations, which we're hearing a lot about, screening, like colonoscopies and other things. And this, again, does sort of primary prevention. And then you can change the context to help people easily make the healthy decision. So that's where, at the Bloomberg School of Public Health, that's where a lot of our work focuses on working on the context or the environment to try and support healthy decisions. So I'll be talking about some of those. And then socioeconomic factors are really where you would have the most impact by allowing people to have a decent income, or the income that they need to take care of themselves and their families, that they have good education, that they have safe housing. All of these things are sort of essential for everything else, and we're hearing about that so much related to COVID, that people who are already disadvantaged are suffering the most from coronavirus infections and death, and so really we have to be thinking about how to address that. So I find this sort of framework really helpful for thinking about the big picture. And so we're going to jump into the host now. I'm going to go through host, agent, environment, and vector around and talk about solutions. But with the host, again, I'm going to show you one last framework, and that's called the social ecological framework. And the idea here is that individuals are nested within their own social networks, within their organizational networks, within their communities, and then within the society as a whole. And this, again, is really helpful to be thinking about because we don't operate in a vacuum. Our knowledge, our skills, our attitudes, our behaviors are all influenced by all of these other levels. And if we ignore that, again, we can only have so much change. So again, if you try and sort of address the individual without understanding their context, you're only going to be so successful. So I'm not going to talk, so there's tons of research on individual level factors that are related to smoking and ways that you could potentially address them, like peer pressure, parental smoking, risk taking, all of that. But I'm not going to say any more about the host, because again, I think, we have to be thinking about the environment in which the host or the individual operates. So I'm going to move on to the agent. And there's a lot happening around the agent or the cigarette or the tobacco product. So for example, Massachusetts just recently instituted a ban on flavored tobacco products, which includes all menthol in cigarettes and all flavored e-cigarettes and other flavored cigars, cigarillos, etc. So they have a really comprehensive state law. So that's something that addresses the agent, trying to make the tobacco product less addictive and attractive. Anyway, so sorry, I'll just go back briefly. So the other, which I should have brought forward, the other piece is that there's a number of jurisdictions are banning flavors in e-cigarettes. And again, we can talk about that more. This is interesting. So this is a page from the Food and Drug Administration, which now has the authority in the US to regulate tobacco products. And they've been thinking about a comprehensive plan to regulate tobacco and nicotine products. And one of the things, so they want to, the idea is to put the most restrictions on the most harmful products, which is cigarettes, and the least restrictions on the least harmful products, which might be like nicotine replacement therapy. So one of the things that they've been talking about is this idea of very low nicotine cigarettes, bringing the nicotine levels down to almost zero, again, to make the cigarette less addictive. We'll see what happens. I'm happy to talk about this idea more with you. And then there's things, so back to the cigarette pack, there's health warning labels. And on the left, there's a health warning label from Brazil. So actually in Brazil, the whole one side of the pack is a health warning label. And there's like, I think 30% on the front now, that's a health warning label as well. This on the right is a health warning label from New Zealand. I think I've got a couple more. So we're supposed to get health warning labels in the US, so it's a long, interesting journey of how we've gotten here. But at this point in time, we're expecting to see picture health warning labels on cigarette packs October of next year. So again, another area that I'd love to talk about. And then there's this idea of plain and standardized packaging. So that's where there's no branding on the pack whatsoever. You've got a big health warning label, and then you've got a standard color for the pack, so the companies can't use their brand colors, and the name of the brand is also in a standard font and font size. So now there are, I think, at least like 10 countries with plain and standardized packs, including the UK and Ireland and France and England. This is a pack from Canada, which got not too long ago. This is a camel pack, so it looks sort of like the others. So this is other ways we can try and make the product less attractive. All right, let me move on to the environment. So we're actually pretty excited about a global treaty that has tried to address this global, it really is another pandemic, and that's called the Framework Convention on Tobacco Control. It's sort of led by the World Health Organization, and it came into effect in 2005, and 182 countries now are parties to the convention. That means that they signed and ratified the convention, and they've agreed to do the things that that are laid out as evidence-based solutions to address the tobacco problem. And so I won't go through all of the solutions from the Framework Convention on Tobacco Control, but I'm going to go through sort of the highlights, which is summarized by this acronym called EMPOWER. And this is genius because we can't like remember 25 different things. It's hard to, but you can remember, 5 to 7 of them. And so this acronym really allows people in public health around the world to know exactly what our asks are, what we're asking for of governments to do. And so that allows us to be more powerful. We're on the same page. We know what we're asking for. And if you can make your ask really clear, it's a lot easier to achieve it. So I'll just tell you, so this stands for, the M is for monitoring tobacco use and policies. So you have to know what's going on in your country. You want to protect people from secondhand smoke through clean indoor air laws or smoke-free indoor and sometimes outdoor public places. You want to be offering help to people who want to quit tobacco use. You want to warn people about the dangers of tobacco use, so you can do that through the health warning labels or through mass media campaigns, social media campaigns. You want to try and reduce the amount of tobacco, or even not just reduce, but ideally eliminate tobacco advertising, promotion, and sponsorship. And then price, as I said, is an important lever. So we want to raise the price of tobacco products predominantly by increasing tobacco taxes. So this is a great way to remember the sorts of things that to keep in mind. So let me just move on to solutions around the vector of disease in the tobacco industry. So actually Bloomberg Philanthropies, this is a screenshot from their website. They're actually investing money specifically into exposing the tobacco industry's tactics and strategies. So they're monitoring and sharing, disseminating what the tobacco industry is doing. And so this initiative is called STOP, so Stopping Tobacco Organizations and Their Products. And this is from the actual official STOP website, so you can look at it if you're interested. So it says that big tobacco wants to keep you in the dark, but we're going to expose the industry. And so this is really important to share information with governments, and particularly the media, to help soften the stage for evidence-based tobacco control policies. And there are always legal battles. The tobacco industry fights as hard as they can, and we just had really a really exciting legal victory against the tobacco industry around actually plain and standardized packaging. The industry first fought in Australia to the Supreme Court and eventually went to the World Trade Organization. The World Trade Organization ruled against them, then they appealed, and now we have the ruling for the appeal. So, we need, as I said, we work with all kinds of people. Everyone has things to contribute to public health work. And so here's an example where lawyers are really important as well. Okay, so the tobacco industry tells governments and the media that it has changed. It's not the tobacco industry that lied about nicotine, decades ago. But really, the tobacco industry has not changed its stripes. And it continues to prey on young people as well as other vulnerable populations. They continue to do this with their lies, their deception, their lawsuits, and they have lots of money to finance this work. So lots of progress has been made, but there's still a lot of work to do. We've got our evidence-based interventions through our Framework Convention on Tobacco Control and Empower. We see countries are innovating. So one example was plain and standardized packaging. And the tobacco industry is losing legal challenges, which is fantastic. But we always need new ideas and energy. And anyone who's, if you're interested and passionate in fighting against evil, this is a really great area for you to work in.